When we say worms in children, we mean parasitic worms that infect and live in the intestines of children. Infection with these worms is also known as Helminthiasis. We are particularly concerned about worms in children because they are still growing and developing. These parasites cause nutritional deficiencies and can affect children's development, including their cognitive development. Worm infection is significant due to its high prevalence. The lifetime risk of worm infection for a person is about 50%, meaning almost half of all people will experience a worm infection at least once in their lifetime. The first and most common cause of helminthiasis in developed countries is pinworms, which are responsible for 80% of helminthiasis cases. A typical patient with worm infection is usually a child aged between 2 and 10 years, presenting with itching around the anus and perineal area. The itching intensifies at night when the female pinworm emerges from the anus to lay eggs, with the movement of the worms irritating the skin. Another important characteristic is the presence of small, white visible worms, which can be seen around the anus or on the surface of stool. Abdominal pain or discomfort may sometimes be present, but not always. The diagnostic criteria for pinworms include the aforementioned symptoms and the tape test. This test involves pressing a piece of adhesive tape against the perianal skin, and then examining it under a microscope to detect pinworm eggs. Other methods may be less informative, so the standard test is the tape test. The treatment includes a single dose of albendazole, which may be repeated after 2 weeks. Another medication is mebendazole, with a similar regimen. Since helminthiasis is easily transmitted, treatment is advised for all family members. Frequent hand washing and washing bed linens, towels, and underwear in hot water to kill eggs are strongly recommended. The most common cause of helminthiasis in children in developing countries is Ascariasis, caused by a different type of worm. These worms are much longer, with a white, creamy color. The main symptom of Ascariasis is abdominal pain and discomfort, which can be cramp-like. These worms can sometimes be found in stool, but not always. The second most common symptom is loss of appetite. Sometimes, coughing and wheezing occur during the larval stage when the larvae migrate to the respiratory system, but these symptoms are usually transient and may not be prominent. Visible worms in stool sometimes occur, especially when the infestation is heavy. The primary diagnostic method is examining the stool for Ascarias eggs. In blood tests, eosinophils may be elevated, which is a sign of a parasitic infection but not specific to Ascariasis. Treatment includes a single dose of albendazole or several days of mebendazole. Other worm infections in children include hookworm infection. This is less common compared to the aforementioned types. Its hallmark symptom is itching, usually on the feet. The treatment is the same, albendazole or mebendazole. Schistosomiasis, snail fever. Symptoms of schistosomiasis include abdominal pain, diarrhea, blood in the stool or urine, fever, chills, cough, and muscle aches. Praziquantel is the treatment for this condition. Cysticercosis, tapeworm infection. Though rare, cysticercosis can be serious, especially if it infects the brain. This condition is known as neurocysticercosis, causing seizures and neurological symptoms. The treatment typically involves albendazole or praziquantel, often used in combination with corticosteroids to reduce inflammation. Most helminth infections occur via the fecal-oral route. In the case of hookworms and schistosomiasis, there is direct contact with the soil, usually infecting the skin of the feet. Cysticercosis is transmitted through the fecal-oral route and also via infected foods.